Well, kia ora, everybody. Welcome to the Evidence to Practice session for 2026. It's really lovely to see you here. I'm going to start our hui today with karakia to call in positive energies. Tūtawa mai I runga, tūtawa mai I raro, tūtawa mai I roto, tūtawa mai I waho, kia tau ai, te mauri tū, te mauri ora, ki te katoa. Homie, hui, tai kie. Well, kia ora koutou. Welcome to this session today. It's great to have some people joining us again. This is the first for 2026, but many people joined us last year. Ko Cheryl Han toku ingoa, he tangata tiriti aho. I'm with the Centre for Family Violence and Sexual Violence Prevention, and I'm really pleased that we're welcoming today Dr. Apriel Jolliffe Simpson, who's sharing research on the patterns of family violence harm by people who come to the attention of police in Aotearoa New Zealand. And then you'll have a chance to ask some questions if you want to, and they'll be facilitated by Dr. Roxy Heffernan, who's the National System Practice Lead here at the Centre for Family Violence and Sexual Violence Prevention. In this session, we want to create a safe and inclusive space. The sessions are going to cover topics of sexual violence and family violence that can be difficult or distressing. So please do what you need to do to look after yourself and to get support if you would like it. We've posted the links to the help portals where you can phone or online chat or find out more information about what kinds of supports and services are available. And in this version of Teams that we're using, you'll only see the presenters. But you will be able to use the Q&A function to ask a question. So please do that and through the presentation, and then Roxy will be picking those up after Apriel's done her presentation. The Q&A is public too, so people who are online will see it. And we'll try to get through as many of the questions as we can. So now I'd like to introduce the presenter, Dr. Apriel Jolliffe Simpson. She's a lecturer at Puna Haumaru, the Centre for Security and Crime Science at the University of Waikato. Her research focuses on assessment, decision-making and responses to crime, with a special focus on offending by young people and on family violence. And we're really pleased to welcome you here today. So I'm going to hand over to you, Apriel. Thank you so much.
Thank you, Cheryl, for that kind introduction, and tēnā koutou katoa. Ko tongariro te maunga, ko te arawa te woka, ko tūwharetoa te iwi, e noho ana aho e te taha o te awa o Waikato, ko Apriel tōku ingoa. So like Cheryl said, my name's Apriel, and I'm here to speak to you today about some of the research I've done on patterns of reported family violence harm in Aotearoa. First off, I'd just like to tell you a little bit about me. So as I shared in my pepeha, I whakapapa to Turangi, south of Taupo, and my mountain is Tongariro. I actually grew up in South Auckland though, and that's where my mum's side of the family were from. And I moved to the Waikato for university a long time ago actually, and have been here ever since. Really love it here in the Waikato. My partner's family are from Tauranga, so I spent a lot of time there, and my family also have all moved now to Northland. They've been there for a few years, so as you can see, I spend my time basically across the upper half of the North Island of New Zealand. I completed my PhD in 2023, and that was the culmination of several years of research looking at the current way that risk is assessed for people who come to police attention for using family violence in Aotearoa. So I did some research looking at what police are doing and also what was happening in the context of our integrated safety response in the Waikato and in Canterbury. And for the last part of my PhD, I did the study that I'm sharing with you today. In the years since doing my PhD, as Cheryl said, I've been a lecturer at Te Puna Haumaru at the University of Waikato, and so I have been doing more research and teaching students in papers like the ones you see here, so introducing them to applying psychology to understand crime and criminality. So my research in the years since has been in three kind of main areas. The first is continuing to improve how we identify, understand, and respond to family violence. I've also had a stream of work focusing on better understanding and supporting victims of family violence and crime more generally, focusing on highly victimized people, and as well as that, understanding offending by young people. So those are kind of where my interests and my expertise lie. And at the end of last year, I was awarded a fellowship to spend the next 4 years continuing to do research on how we identify and respond to high harm perpetrators of family violence. So my talk today is really about unpacking one of those widely held assumptions when it comes to family violence. There are lots of strong beliefs in this space, often motivated by really strong intentions to prevent further harm. And one of the beliefs that I think is strongest and is often echoed in public sentiment is this idea that once family harm begins, if we don't intervene, it will definitely continue and it will definitely get more severe. So this idea that escalation and frequency and severity is inevitable over time without intervention. And indeed, family violence has been referred to as the quintessential repeat crime because of the way that it often does occur as a pattern over time, with each instance of harm needing to be viewed as an episode in a series rather than as an isolated event. And of course, we look to our death reviews to try and understand what we could be doing better to pick up on this pattern and prevent severe harm and homicide. So this, when we look at our death reviews, this retrospective analysis of the histories of people who are involved in family violence homicide often does reveal that there are missed opportunities, that people might have had contact with agencies. And this leads to questions about whether we could have detected that likelihood of escalation and intervened to prevent it. So kind of as a consequence of the sentiment, there's been a widespread push for people responding to family violence to pick up on that risk of escalation and continued harm. So for example, frontline police officers who respond to a really large volume of cases are tasked with picking that up. And it's problematic because with that volume of cases, they often end up responding as if they're responding to single events rather than seeing that full, that episode as in that context of a series of harm. And it's also relevant for our workers in different service organisations who are trying to provide support, wraparound services to people experiencing family violence. So if we believe that every case will inevitably continue and escalate, that puts a lot of pressure on people to try and deliver heavy support to everyone who they can reach. And in fact, this is reflected in public sentiment. So there were some news articles talking about the integrated safety response and crediting it with saving lives through their risk assessment and case management practices, which is of course great. And I'm sure that we are having that impact, but it just reflects this idea that it's something that is inevitable, that we should be responding to, and that our practices need to be geared towards. With that said, there is actually limited evidence that further episodes are inevitable after an episode is reported, or that episodes will increase in severity. Some cases might be characterized by a single highly harmful event, while others show diverse patterns in both the frequency and degree of harm associated with the case. And you can see this in the fact that in the year between July 2024 to June 2025, police carried out over 170,000 family harm investigations. So if every case was inevitably going to continue and escalate, we would see that reflected, and we don't. So there's a disconnect here where we have this idea that escalation is inevitable, but it's not what we see playing out. But of course, there are cases that are severe and result in severe harm and homicide. So all of these things can't exist at once. We have to get a better understanding of what the patterns are and what's really going on. In fact, in some jurisdictions, some of this work has been done. So longitudinal research, primarily based on information that's reported to police, has identified the most common patterns involved repeated low-level call-outs or no further episodes. So Pakero, for example, looked at rearrest data in the United States, and they found there was this really heterogeneous mix of different patterns. And there was also a study by Jones and colleagues that looked at different patterns, and they found that there was a small group, about 2%, who persistently remained in a severe state of committing severe harm. So we can see some evidence overseas, but the work hasn't been done here. So I wanted to understand, in our context, what are the common patterns in harmful behaviour that's reported over time for people who are coming to the attention of New Zealand police for using family violence? And to answer this question, I collected information about just over 2,000 family violence episodes that were reported to police in the Waikato and Canterbury regions in 2018. And then I followed those people for 2 years. So for each person who was identified as the aggressor in that initial episode, I collected all the information about further episodes reported to police over the next 2 years where that person was again an aggressor or in a kind of mutual participant role. And then what I did was describe the patterns and the harm that was reported over time. So just turning our attention first to the sample for the study, I'll just tell you a bit about the characteristics. So about 75% of the aggressors were men. We had approximately 40% who were Mauri, about 40% who were European, and the remainder were in a group of other ethnicities, which included Pacifica peoples, Asian peoples, Middle Eastern, Latin American, and African peoples. So lots of different groups. Most of the cases were between current partners or former partners, about 2/3, but we also had cases between parents and children, siblings, and people in other family relationships. And I also looked at what risk scores had been assigned using other tools that already exist to cases in the initial sample. So about half of them were assigned high on police's safer risk category, and about a fifth were low, with about 15% having no score, which basically means people don't have criminal history information. So the safer is police's automatic risk tool that's based on information in police databases about people's criminal histories. And so if a person has no score, it means there's none of that information. So they might be young or from overseas, for example. So it's fair for the no score category to be treated kind of similarly to the low risk category. So this is the distribution of the scores we saw on the safer risk tool. And then this is the risk category on the dynamic questions. So these are the questions that police ask at the scene of the episode to try and understand information about the current context affecting the family. So we can see about 2/5 of cases were assigned high, and then the rest kind of scattered between low, moderate, and also not answered. So sometimes people, for lots of different reasons, don't answer the questions. So maybe, for example, police weren't able to speak with the victim, and so those cases are captured there. And finally, I mentioned before that I conducted this study in the Waikato and Canterbury regions. So that is the areas where the integrated safety response are operating. And so I had the risk category that the ISR had assigned to cases. So you can see very few cases were assigned high risk, about 6%, about half were medium, and the remainder were low. As to the characteristics of those initial cases, over 90% involved verbal abuse. About a third involved physical violence. Fewer than 1% involved sexual violence that was reported. 13% involved threats of harm, and about 14% involved property damage. So at the time I conducted this study, those were the types of harm that were recorded in the Family Safety System, FSS, the database that ISR uses. And so I used those types of harm as the indicators of harm for this study. I didn't just rely on offence codes that are assigned. We know that quite often incidents do involve offences, but offences aren't recorded. So instead of using those, I looked at what types of harm were recorded in FSS for cases. So the next part of the study was collecting information about further reported episodes over the 2 years. And somewhat surprisingly and I think this is a good thing. What we saw was the percentage of cases with a further episode reported to police decreased over time. So we recorded further information in 3-month periods, and what we saw was that each 3-month period, the proportion of cases who had further episode reported continued to decline. And the final step was describing patterns of harm, and that's what I'm going to talk to you about now. There were 2 parts to this. If we think about kind of our initial episode and then the process over time where we looked at further harm that was reported, I have these 3-month intervals. So within each 3-month intervals, what further types of harm were reported? The first step, therefore, in my analysis was to work out what were the common patterns in each 3-month snapshot in harm that was reported. So if we're looking at kind of the steps along the way, what were we seeing along the way? So the information that was reported at 3 months intervals could be kind of summarized in 3 categories. The first was this state where there was a very low, almost no probability of any kind of harm being reported. And for about 60% of cases, this was the state that they were in the 3 months following that initial episode. The second state was characterized by a small probability of verbal abuse being reported, a smaller probability of physical harm and threats, and that was the state that about 5% of cases were in the 3 months after that initial episode was reported. And then the third state, which is the state that about 1/3 of cases were in the 3 months after their initial episode, involved an almost certain probability of verbal abuse being reported, moderate probability of physical harm, and small probabilities of threats and property damage being reported. And there is a bar there for sexual harm as well, but it is very low. And I think that that is to do with the barriers to disclosing sexual violence in this context. Remembering I'm using information reported to police. So I've told you a lot about the information I recorded and kind of what we were seeing in that initial period or in those 3-month snapshots. But what I was really interested is in understanding what were the common patterns in harmful behavior over time. So here's what we found. We found 4 kind of pathways. The first of which, so on this graph, the y-axis is kind of the state people were in. So down the bottom is that state where there was no harm being reported, and up the top is that state where there was higher probabilities of harm. And on the x-axis is the months since the first episode, from 3 months all the way to 24 months, which is 2 years. So the most common pathway that we identified involved no reported harm. So for about 60% of cases who were referred to the ISR, this was the pathway in the 2 years following. The next most common pathway that we identified involved de-escalation of reported harm. So this was where people were initially in that latent state involving more like higher probability of harm. They de-escalated to the state with lower probabilities of harm before finally de-escalating further to the state with no further harm. The next most common path we identified, however, involved high reported harm. So this was where people moved between that state with higher rates of harm and the state with lower rates of harm and kind of cycled through that across the whole follow-up period. And this pathway fit about 15% of cases. So that is still a fairly large group of people who were affected by this kind of chronic and higher levels of harm over the 2 years following that first episode being reported. And then finally, the least common state that we identified involved low reported harm. And the reason I called it low reported harm rather than escalation, which the line does escalate, but it escalates from no harm being reported to low harm being reported. If you cast your mind back to when I showed you that initial graph, that state 2 involves kind of low probabilities of verbal abuse and physical harm. So there is harm occurring, but not at that same level as that higher state. So those were the pathways that we saw over time, and you might be interested in the characteristics of the people who were experiencing those different pathways. I told you a little bit about the sample in the study at the beginning of this talk, so just circling back to that. So first, if we look to gender, we found that there were some differences between men and women, whereby a greater proportion of women were in the no reported harm pathway. So when women were aggressors, this pathway was more likely to a small degree. And you can see that reflected where there's a greater number of men who were in those de-escalation and high reported harm pathways compared with women. As far as ethnic identity is concerned, we saw a pattern whereby Mauri were overrepresented in the pathway involving de-escalation and higher rates of reported harm. And as far as relationship type was concerned, this was interesting because we saw that the high reported harm pathway was more common for current partners, but also for siblings, which was quite interesting, and I would really love to unpack that further. We did see as well that current partners had a lower rate of that no reported harm pathway compared with people who were former partners or in other family relationships. And this makes sense if you think about the context of staying in a relationship. It might create potentially further opportunities or situations where harm can occur. But again, that needs unpacking further. And I also told you a little bit about the other risk tools that I had access to. So this is the SAFER. This is police's risk tool that's just based on the aggressor's criminal history. We saw quite a good pattern whereby the high reported harm and de-escalation pathways were more common for people who had been assessed as high risk, and this kind of steady pattern where the proportion of people with no reported harm was higher in the lower risk categories. So this means that this tool was kind of ordering people in the right way, where lower risk did actually mean lower risk. The same can't be said for the dynamic questions. So this is police's other risk tool. That is where officers are asking people questions. There are some problems with this tool that police are aware of, and they're rolling out a new redesigned version later this year. So I'm really excited to see the improvements that happen here. But something that's interesting is you can see the bars for the de-escalation and high reported harm pathways are actually higher in the group of people who don't answer the questions. So that might suggest that there's something going on in cases where people aren't able or willing to speak with police. In this context, that might indicate risk is higher potentially, but the bars are kind of similar in the other categories too. So this tool was not doing a good job at ordering people in terms of their risk. And finally, I looked at the integrated safety responses risk categories, and we see promisingly that the bar for people in the no reported harm pathway was highest in the low risk category, and that the medium and high risk categories had higher bars for de-escalation and high reported harm. But it does look like there wasn't a lot of difference between the medium and high risk groups here. And overall, what we saw is, so this graph shows the percentage of cases and then what state they were in each 3-month period over time. And we saw this trend where over time, the proportion of aggressors who were in that low harm state increased, and the proportion who were in the higher harm states decreased slightly, with some differences there. So this is a promising picture. What does this all mean, though? I just want to start off by saying that no family violence is acceptable, and I'm not seeking to minimize the harm that occurs in cases. I think that all cases should be provided access to support services. But at the same time, I think that this research supports the idea that our really intensive efforts to work with people and safeguard people should be focused on the people who need it most. So this research aligns with what previous studies have found in other jurisdictions, that aggressors do not inevitably repeat or escalate their harmful behaviour, and it is a small subset of cases that disproportionately account for a large proportion of harm that's reported. Indeed, what we saw was these kind of 4 different patterns. Each might reflect different kinds of situations, and as this is quantitative research, I would love to do research with other methods that helps me unpack it more and contextualize it more. But if we think back to our police officers and our service workers who need to make decisions about how to respond to cases, it is clear that using valid risk assessment is a good approach. What I found is that 60% or almost 2/3 of cases belong to that no reported harm pathway, with about 15% in that high reported harm pathway. What we need to better support the practitioners is risk assessment tools that are valid and help workers to identify these people who are likely to experience those harmful patterns over time. We saw that the SAFER performed best, but that doesn't account for contextual factors. It's just based on criminal history. The dynamic questions were not great, but it's great to see that police are overhauling them. And the ISR's assessments were pretty good, but could benefit from more structure to kind of improve consistency and better separate out high from moderate. So I think that understanding these patterns over time can give us some more confidence in using assessments and some more motivation to improve the assessments that we do have. Limitations. No study is without limitations, and there are 3 that I'd like to raise here. The first is, of course, I was focusing on what's reported over time. I would love to speak with people. One of the studies I cited earlier, they did this study, but where they called victims every 3 months to get kind of a synopsis of what had been happening, and they found similar patterns to this, which is reassuring. But I would still love to do that in our context. But with that said, the purpose of this study was to understand what police and service workers can do when working with cases that do come to their attention. So the results should be understood in informing that context. As well as that, I only had 5 different types of harm that were in FSS at the time to use as indicators. More have since been added, things like psychological harm. I am personally very interested in coercive control. Some of my more recent research has been on that. And so as part of my ongoing work, I'm going to be looking at different methods for incorporating and accounting for cumulative harm and different types of harm that occur in family violence contexts. And the third point is we didn't have enough quality information about interventions to be able to understand the impact that they might have had on those pathways. So, for example, that de-escalation pathway could indicate that our interventions are having a good effect, but we need to improve the quality of information that's recorded and how it's recorded so that those things can be brought together and we can understand that impact. So I mentioned my eagerness to do more in this space. I'm really grateful for the fellowship that I'm about to start working on, which is squarely focused on continuing this aim of better understanding what people in Aotearoa view as high harm and developing a systematic way to better identify and respond to the people responsible for that high harm. So a brief thank you to my co-authors. These were my PhD supervisors who I did the study with. I'm very grateful for police and the ISR and also to all my services who supported my research, the scholarships that supported it, and also to the Centre for inviting me to speak with you today. Finally, this QR code takes you to the academic paper that has been published about the study that I presented to you today. So if you're brave, feel free to read that. And here are some references, and I welcome any pātai.
Oh, kia ora koutou, and thank you, Apriel. That was a very interesting but surprisingly simple explanation of what is quite a complicated piece of methodology and quite a complicated paper, but I do suggest that people read it. It is good. I'll start with a couple of questions in the chat, if that's okay, and then if there's time, I'll move on to some of my questions. So Claire has asked, how many of the aggressors in your sample of the 2,000 plus episodes were repeat aggressors? Did you capture that information?
I did capture that information, but I can't tell you the number off the top of my head. I can tell you that about 60% were in that no further harm pathway. And I'm just trying to open the paper behind this so I can find that number for you. But it was fewer than half. And something we also found was that if people were going to have a further episode reported, that tended to happen within about 5 weeks-ish. That was kind of the average time to another episode being reported.
Cool. The second question was about the actual interventions for people who were in that lower risk state and whether that might have helped them remain lower risk. And I was also thinking about the de-escalation pathway, and you touched on that and how it could be that the supports that we're giving people who are in those lower harm pathways might be part of keeping them low or de-escalating them.
Yeah, it's a really good point. I really think it depends on what we're doing. So research consistently shows that if we use heavy-handed approaches with people who are low risk, that are against their wishes and best interests, that can be really harmful. And so intervening too much with people who are low risk can increase their risk. But at the same time, I do think it's important that people have access to support, and if they're willing to engage with it and they view it as helpful, then that's great. So I think that if that's what we're doing with low risk cases, then I do think that's supporting them to stay on that pathway. But I think that we have to be sure not to over intervene and inadvertently worsen circumstances in cases where we shouldn't.
Yeah, I guess that's one of the dangers of assuming that everybody will inevitably escalate their behaviour, is that we do, impose a lot of statutory responses on people who probably don't need them and don't want a lot of people, a lot of different services contacting them.
Yeah, it's well intentioned and it's comes from a good place, but we have to make sure to not cause any intended effects, like we see often that one of the best predictors of future system involvement is past system involvement. So we want to make sure that if we are involving people, that there is kind of a sufficient level of risk to justify the actions that we are taking.
That makes sense. So one of the questions I had, you talked about the 3 different risk tools that you looked at. So the police, static and dynamic tools, and then the tool that the ISR sites were using. I'm interested in why you think they have, because they had quite different proportions of the cases that came out as high risk on each of those tools. So in the police ones, it was sort of half for the static, I think, almost half maybe for the dynamic, or maybe a third. And then for the ISR tool, it was a much smaller proportion. So I'm interested if you have any thoughts about why the proportions are so different. And obviously in the police ones, it's most of them are not actually going on to have further reported harm. So I'm interested in 1, why you think those are different, and 2, what sort of proportion would you think that we would be picking up if we were trying to get as many of those people that were experiencing that higher harm pathway?
Yeah, that is a great question. It's a bugbear of mine in that I think that high should mean high, but tools use different thresholds because they're in different contexts. So, and that's actually okay. It's just I don't like that the labels are all the same. But anyway, if you think about the context of a police risk assessment, they are trying to make sure that they refer on people who probably need further support. They know that cases are going to be receiving further triaging, assessment, and support. And so in that context, high risk means something different. It's more about officers not missing something and making sure cases get passed on than it is about really identifying people who are more likely to experience severe harm. Rightly or wrongly, that's kind of the context that they operate in. And because cases that are seen as high risk, perhaps they're more likely to receive a police safety order or something like that, but it's not necessarily that means someone will be arrested. There's a whole different set of decisions made there. So that means that they can set their threshold quite low for what high means. But in the context of a multi-agency response, high risk means something very different. The kind of level of service and intervention that is provided is such that it wouldn't be possible, let alone justified, to do that with half of cases. So high means something different. Yeah, so it depends a little bit on how much resource there is and how that organisation has conceptualised what high risk means. So I think it's okay that the thresholds are different, but it does mean we need research like what I've shown you to show what the actual probabilities of ongoing harm is and when someone's given that label. Because if you look at Decipher and you see that label high, that it means they're probably not low, but it doesn't necessarily mean they're as high risk as maybe a score from another tool means. So it's just important to have the research to support that understanding.
Right, that makes sense. So the tools have slightly different purposes because they're used for in a different context. You mentioned just before that you don't like the labels, the low, medium, high. Do you want to say a bit more about that and what you think would be a good way of kind of categorizing people that would be a bit more meaningful?
Yeah, so there is a whole kind of movement towards this in different jurisdictions and kind of for different kind of contexts where people are trying to use labels that more accurately communicate the probability of further harm or further offending rather than high, medium, low. So it might be something like average or elevated or not currently high or something like that. So I'm a big fan of Carl Hanson's 5-level risk and need framework. And the idea with that is each level, so they're saying tools should have 5 levels, and each level actually means a certain probability. And so you do research using that tool, and then you create the categories based on the probability. And the idea is that in the long run, we'll be able to pick up tools in different jurisdictions, and each level actually means something. I think that would be great, but we need to do so much work to get there.
Yeah, well, in order to know that, you'd need a tool that was used quite consistently across a particular context, for example, a multi-agency context, and then you would need to do a lot of research to validate that, right? And work out what each risk level means and where to put your thresholds.
Yeah. And the research can absolutely be done. It's just like you say, we need something that is completed consistently. We need to make sure that, if we have this tool and we find it works well in Waikato, well, does it work well in Tairāwhiti? Does it work well in Northland? Does it work well in Wellington, for example? So I'm really interested in that. And I'm also interested in whether tools perform fairly for different groups of people. So, for example, men and women, Maori, non-Maori. Some of my research has looked at that, as well as whether it works well for partner situations and other kinds of family violence, or young people, for example. So all of this work can be done, but it requires us to actually kind of score the tool or say yes or no to the factors, so that we can then look at how that relates to whether harm occurs later.
Right. Okay. Sorry, I'm just scanning through. We've had a lot of questions come through in the last few minutes, so I'm just trying to work out if there's any that we haven't picked up on. Oh, this is an interesting question. Is there any chance that the de-escalation was due to the aggressors knowing that the study was happening? People wouldn't have known because they weren't involved, were they?
Yeah, so how it worked was I worked with the family safety system. So I wasn't interfering in people's lives. I was just looking at the patterns that came through and what was recorded in the family safety system. So there was a lot of vetting and confidentiality procedures around my being able to do that work. So that's also why I'm so grateful for police and ISR trusting me to do this work. But I didn't intervene or interfere with people. So that's really important. It's a limitation in one regard, because I wish I could have gotten people's perspectives. But on the other hand, it is good in that I wasn't interfering, like that question was asking about.
Cool. Another question in the chat. Were you able to account for coercive control across the different types of harm that you looked at?
So I would have loved to. I actually published another paper, which I can find the link for, looking at coercive control in police reports and whether or not that improved our ability to assess further the risk of further calls and physical violence over and above police's safer instrument. So coercive control I'm very interested in, but at the time it wasn't systematically available in the family safety system. So I wasn't able to use it in making these patterns, but I've done another study where I accounted for it. So I'm just quickly going to get you the link for that one as well. I'll put it as a reply to Holly's one on the first paper. Yeah, so not in this study. I really want to do this study again, but after having identified a fuller and more holistic picture, I'm interested in the new fields that have been added in FSS, but as well as that, the information that describes what happened in the episodes, I might be able to identify maybe some key words and things that are associated, for example, with coercive control. That's what we did in the study that I've just shared a link to, but that involved us reading through hundreds and hundreds of reports and manually doing it. So I learned so much through that, but it's very, very slow research. Yeah.
Yes, I can imagine lots of free text fields to be coding. Takes a really long time. I wonder if this is a good time to ask about some of the research that you're planning on doing next and how you are planning on looking at different types of harm and how they impact people.
Yeah, I mean, thanks. Chance to talk about what I'm most interested in. So I have lots of different plans. There's kind of different streams of work happening. So I'm working closely with police on improving and validating their risk instruments. So that's kind of one strand of work. And I'm also working with the centre, I hope, to improve and evaluate what's happening in that space, in the multi-agency space. And I have a really good relationship with ISR Waikato, as well as Te My Services. But in addition to working directly with agencies, I also have kind of my own body of work, which is really focused on understanding what people view as most harmful. So I am going to soon begin doing some surveys, focus groups hui with whānau, to understand from their perspectives, how should I capture, like, what different kinds of behaviours are understood as harmful, and how can I capture that and combine that? So like I mentioned earlier when I was talking about how there might be different patterns of, say, a single highly harmful event versus a pattern over time of coercive control, perhaps some physical violence, perhaps not, perhaps threats, I don't know. How do I kind of put together all of those different things so that if I'm validating a risk tool, I can go, here's the outcome that people are most concerned about preventing, and how do I find the factors that help us understand the risk of that and prevent that? So it can be done, but part of it is, so it's really easy to go, oh, well, this is an offence, therefore it's more serious than this other thing. But we know very well that offences don't always align with what people view as most harmful and cumulatively harmful. So it's kind of taking the approaches that we've already got that mathematically kind of weight different offences relative to each other. I want to do that, but with different behaviours and combinations of behaviours. So it's a lot of maths, but it's also really grounded in people's perceptions and experiences. And once I have got that, then I will be able to look at how well our different risk tools, so what our multi-agency responses are doing, police, how well those are aligned with the outcomes that matter to people most. That's the goal. I've got 4 years, so we'll see.
That's really cool. And I like how you've got all the different methods. I know you like the numbers and the number crunching, but it's great to also, you know, be talking to people and be using that to inform what it is that you're looking for when you're looking at the numbers as well. And so important for us to not just be thinking about, can we predict another offence, which is what most of the tools give us, but actually, can we predict the things that we know are harmful for people, and then put our efforts there to prevent all types of harm, not just that, offending or physical violence as well.
Yeah, it's funny you say that I love numbers, because I do now, but when I started my PhD, I had virtually no research experience with numbers at all, and I came from a sociology and psychology background, and so I really challenged myself by choosing to do a PhD project that was so grounded in using these kinds of methods. And it's been really nice to come out the other side of it. Now I can do that, but I can bring this kind of, like you're saying, those other knowledge and perspectives into it. And I just think mixed methods is the way to go. Whatever problem or question you have, using the approach that best helps you answer that. And so I'm really thankful to have a job where I'm allowed to do those things.
Yeah, that's really cool. I presumed that you always loved statistics from the papers that I read of yours, but that's really interesting that you chose to challenge yourself that much with a PhD. Well done.
No, yeah, I didn't even do science in high school, and now I'm a scientist. So, you know.
Oh, that's awesome. I'm glad that you're doing this, because we need a lot of this in the space that we're working with, and it's cool that we're able to use it in real time to impact on some of the work we're doing as well. I'm just going to try and squeeze in another couple of messages, questions from the chat, because there have been a few coming in and I'm struggling to keep up with them. One of the questions is around whether there was any risk to children in the tools that we used.
Yes, so the tool that included more of a consideration of risk to children, the police's dynamic questions was the one that performed the worst. There are lots of different reasons for that, including the fact that officers don't really know why they're doing it. They see it as a waste of time. So there's kind of some other things potentially going on. What I did do when I looked at patterns of further harm is I included harm to any family members. So I wasn't just concerned with if it was the same victim. I didn't know if it was the same relationship, which is a limitation. And you might think that end of relationship helps explain some of those patterns, particularly de-escalation, for example. So I wasn't able to look specifically at harm to children, especially because in cases where children are the primary victims, they tend to go through a different pathway rather than a multi-agency service. But if there was harm to children that was in the subsequent episodes, it was absolutely captured in the patterns. So it was harm to any family, not just the same victim.
Right. Okay. I think that helps answer another question or two that were in the chat as well. This is a good question. Are there any risk assessment tools that you know of, perhaps internationally, that have quite good consistency for all people, or are there always kind of limitations for underrepresented groups?
So yes and no. Of the tools that I've looked at, because I've looked at some of the fairness aspects, police is safer, the static tool that's just based on criminal and family violence history for the aggressor, is actually the most consistent for different groups. I found that the dynamic questions were not better than chance for non-IPV situations, so other kinds of family violence, and also for women and for Mauri. So the safer is better in that sense. It's actually fairer. In terms of tools internationally, I think the LSCMI is pretty good, but that is created for general offending. There is the SARA and the ODARA, but they've been looked at in the New Zealand context before, and they weren't like bad, but I think we can do better, and they are really focused on just partner violence situations. Some of the work I want to do now, the ongoing work, is looking at how we can, like, what's the fairness of our tools we're using? How can we make them better? Because I did some surface level stuff, but I want to unpack it further. I would say, honestly, even if we import a tool from overseas that looks like it's pretty fair, which there are some, we still need to check, because you see patterns where for example, there might be a tool that appears fair in Australia for Indigenous people and for non-Indigenous people, and then you use it in Canada and it's not fair for Indigenous people there. So you really just actually have to do the research, and we can do the research. It's just getting access to completed tools and the information about what happened next. So there are some tools that are better than others. For me, the biggest gap, in addition to just not having enough research here, it's particularly in the non-intimate partner space. So I think that because we will create tools and add factors that we think are special to intimate partner situations, that means there's like a whole section of the tool that's not relevant for non-intimate partner family violence. So I think finding those core indicators that are the best predictors in general, and then adding kind of more specialized assessment later, would be the way to go. And that's what we see with police is safer. That's just criminal family violence history is actually the most consistent and fairest that we have at the moment.
Okay, I'm going to try and squeeze in one last question in the last 2 minutes. So no pressure to answer it as quickly as you can. But one of the suggestions that you made in the paper as well was around multi-agency risk assessment. I'm wondering if you have any like quick thoughts about the different sources of information, because obviously the police tools, a lot of it is either just history or the information police have at the site. But obviously, if we had access to different sources of information, including maybe people's voices who've been involved beyond just what police are seeing, maybe that would be a step in the right direction.
For sure. I think that if we have information about victims' level of fear, we should absolutely include that. I think if a tool says low, but we have a very fearful victim, we should definitely escalate it. But at the same time, if the tool says high and a victim's not fearful, I don't think it goes that way. So I think that we should account for victims' voices and their perceptions of safety, but to escalate rather than to de-escalate our risk judgment. In terms of different information sources, we do have to be aware of kind of the limitations. There might be limitations to what people are willing or able to share with police, and then more information might be available after a person is able to engage with a worker in a family violence service, for example, or there might be other, like health or ACC might have information. So I think that risk assessment should be viewed as something that gets updated each time there is better information, and especially better quality information. It's a decision support tool, it's a triaging tool, it's not in place of professional skills and expertise, but I think it's clear that we need it as a way to triage at that front end and to make sure we are focusing resources more on the people who need it most. But it's not just that, okay, police says this we stick with that.
Yeah.
Absolutely not. I think we need a tool. In my perfect world would be a evidence-based tool that was not too long, that just included indicators that were associated with further family violence, that everyone used. So if police started out putting the information they had, and then it got updated once our agencies had more information, for example, and we come back to it when new information emerges, that to me would be gold standard. And if we had something that was that consistent, then we could get the evidence on, okay, how do we make this fairer? How does it perform in different contexts? That's what I'd love to see. Yeah.
I would also love to see that. That sounds like a great idea. And I will now stop because it's 4 minutes to, and Cheryl will be wanting to close. But thank you so much for your answers, and thank you for all the questions in the chat. Sorry if I didn't get to them all. Yeah, over to you, Cheryl.
Thank you. Thanks so much, Apriel. Thanks, Roxy. It was really great listening to your conversation and your discussion. It's so important for us to have that detail about the patterns and the pathways and understanding of the different forms of family violence. And it's really great to hear, Apriel, about your future research. I hope you'll come back and talk to us again and share some of your findings. And it looks like there's a lot of interest in the risk tools and what is available to understand family violence risk. So we'll be looking for some future research in that we can share with you too. So thanks, everybody. Thanks for your questions. I hope you've managed to get some of them answered and look up the research that we've posted the link to. And if you've got some suggestions for future sessions, please email us and let us know. The email address is relationships@preventSV.gobt.nz. And look out for the invite for the next session in late April. It'll be on our LinkedIn and out through our pānui. So email us if you want to get on that list. Thanks for joining us today. I'll just close with karakia. Kia tau te rangi Māori e ki runga ina iwi Aotearoa. Haumie hui e tai ki e. Thanks, everybody. Go well.